And I also have to say here that I am a stand-in. I'm really substituting for Dr. Michal Gindi, who is the head of Adventures and Innovation and Radiology at Assuta Medical Centers. And she would have been here to present herself, except for she is in Chicago at the RSNA conference, which, as I'm sure many of you know, is probably the largest conference in the area of radiology on an annual basis, presenting all of the innovations in that area. So I'm standing in for her, and a lot of these slides were actually created by her. I want to focus on developing AI in clinical settings specifically. And just to say, along with kind of as a counter to what Guido said, it is true that AI is enabling us to focus on the patients, but we have to really remember that if we don't have the professionals and the clinicians on board, we actually are missing our foundation. So, and I think that their concern is taking care of patients. So a few words about Assuta Medical Centers. It's Israel's largest and leading chain of private hospitals and medical centers. They have 8 medical facilities nationwide and treat more than 1.25 million patients on an annual basis. And basically, in terms of their vision and their mission, they see themselves as people-centered, with a very strong focus on human dignity and privacy, providing a unique health experience and pursuing quality and excellence. And I'm only showing you these slides because so you can see how much data that we have available ultimately for AI, which is what we're going to talk about. What you see here is that they perform annually over 100,000 surgeries, and you can see the various in all areas of medicine. They do over 800,000 diagnostic tests and procedures every year, and they also have 100,000 specialized treatments that are completed yearly. And probably I should mention, just simply because it's a kind of a unique Israeli thing, is IVF. Israel is probably the IVF center of the world, just simply because it's the only place I know where IVF and fertility treatments in general are part of the basket of services, unlimited, until you have 2 take-home babies. So we do a lot of stuff in fertility treatment. Now, how do we look at AI from a clinical perspective? So it's affecting healthcare delivery. We see it at the point of care. We're looking at it as to help us with precision medicine. It will also, and this is repeating sort of what Guido said, it affects the patient role and the patient's level of autonomy, but it also affects the physician's role and also other healthcare providers. And it can take information from places where we didn't take information before, for example, social media. And we see that AI solutions are already affecting global health care delivery. We're talking about AI-enabled population health, frontline healthcare workers with virtual care assistants, and we talked about that a little bit with vCare in the earlier session, patients' virtual care assistants, and of course, physician clinical decision support tools. So what has Assuta done as a healthcare provider? It basically has teamed up with Nvidia on healthcare AI, and it's launched an innovation center, which is intended to enable startups and medical researchers to carry out research and development of AI-based solutions. And our assumption and the foundation of what we've done is that clinical collaboration is crucial for success. Both first starting with product design, where we have to have co-development, which involves product market fit, clinical consulting, data sharing, assistance with fundraising, clinical trials, which to validate, and taking care of regulation and piloting solutions. And when we talk about pilot and the first deployment, it's really important to get clinical feedback in order to be able to enable clinical use, system integration, and of course, operational and economical validation of the algorithms that we're using in our AI. And ultimately, then we also have to deal with growth, which gets us more to the market issues. So in establishing this development center for AI intelligence companies, we basically set it up. Today, we're working intensively with 20 companies, 3 of which who've already received data from Assuta using the Nvidia system, and 4 others will receive data within a few months. And what we've done is we've created a dedicated sandbox environment for AI developers and researchers, which gives them secure access to de-identified data, strong on-premise capabilities, a scalable cloud environment, and multiple tools for development, such as Clary and BYO. And this actually then enables collaboration between industry, between all of these development companies with Assuta across all of the development phases: data preparation and modeling, retrospective analysis, real-time inferencing and validation with medical teams. And this is just a picture of our team. So what influences the success of AI companies? And this is what we look at in terms of the companies that we are working with. So data quality, use cases, the business model, ethics and privacy is for sure a really big issue. Of course, regulations, and as you can see in terms of our focus, it's really important that companies have a clinical partner in order, if they're developing AI in the medical and healthcare field. And I think that when we look at what the critical success factors are for really advancing AI in the clinical area, in medical care, and in healthcare for patients, one thing that's really important is provider motivation. And we need to answer the question, what motivates providers to invest in innovation? Because somebody has to pay the bill here. I mean, it's really nice to have Horizon 2020 and Horizon Europe money, but ultimately there has to be a motivation to invest in innovation. And I think some of the things that motivate providers are the ability to give better care, to do prediction better and have more accurate prediction and reduce uncertainty. And I think also other issues that are important, and we should not forget them, even though they sound a little crass, and that is image and reputation. This matters. Another critical success factor, which I have repeated and I will repeat it again, is collaboration with clinicians and collaboration with industry and collaboration with researchers. And I think finally, we need to focus on the practical. In other words, what we need to ask ourselves is, where is AI going to provide significant added value? Because there are a lot of other aspects of digital health besides AI. And as we develop and evolve the use of AI, I think the value added question is very crucial, and we need to ask ourselves, because given the hype for AI, we have to remember that it's not the end all. It is something that can contribute, and we need to see where we want it to contribute and decide what we want from it. Thank you.